Good evening, my friends and colleagues. Welcome to the 2020 MSDC annual meeting. Well, my friends, this is certainly a different kind of meeting. I would like to start in a unique, lighthearted way. So please go ahead and grab that drink that you were asked to have at your side. I have mine here, one that was specially prepared for me. As you all know, MSDC was founded more than 200 years ago by DC physicians with the goal to combat medical imposters and fraud. They were a group of white men having a drink at the bar at the Wheeler Hotel. The locations and the methods of gathering have changed throughout the years, to the point that here's your first Latina woman president talking to you through your electronic device. Can you believe that? Today, as MSDC continues to advocate and represent you before the lawmakers, the public, and the press, we all gather together so we can learn from each other and to continue to fight medical misinformation. Do you remember bleach? Bleach injected into veins? Anyone? I've been an MSDC board member for many years, and when I was asked to be your president, I thought to myself, I am finally ready. I got help with my practice, I became an empty nester, perfect time. But just as I was starting to get the groove of the job and getting used to having my home organized, here comes my son back with his 12-size shoes all over the house. And also the corona, not exactly the beer, but the virus. COVID-19 has really humbled us. It has been a struggle to treat patients while dressed like astronauts. Meanwhile, we also had to learn how to manage new medical situations, how to manage our own emotions rising from the pandemic. This year has also shown the best of us. Our physician community has risen to the challenge of keeping the district safe. Even as the pandemic continues, our medical community earns the title of heroes. We have, and we continue to do, a good job here in DC. As you all know, it was my number one mission to provide all of us with tools to be better heroes. A few months ago, MSDC launched the Healthy Physician Program. It is a wellness initiative that provides support to our physicians suffering from moral injury. I am happy to say that the HPP is supported by an award from the Institute of Technology in Healthcare. So now, active MSDC members can speak for free to wellness professionals, the majority of them being physicians. Each of them specializes in different life and work situations. Don't hide your burnout or struggles at work or at home or in your career. Let MSDC help you. All you have to do is visit msdc.org/wellness to learn about all our resources. The best part is that it's confidential and is separate from your employer. Advocacy is the lifeblood of our profession, and not being able to enter the Wilson building has not slowed down MSDC's advocacy efforts. I have had the privilege of participating in healthcare virtual roundtables with the council, testifying on the district budget, and updating the Board of Medicine on our initiatives. Many of you have done the same, and you know the value of this. This year, we have seen MSDC victories in many policy areas. I am proud of our work. We are aligning MSDC work with the modern needs of our members by creating several task forces. The MSDC Unconscious Bias Task Force launched a survey to study the impact of unconscious bias in medicine in DC. And around 300 physicians answered the survey. The results are being analyzed, but I can share that the information is eye-opening. We also created a membership task force to work towards the creation of a new model for you, our member, so you can maximize and individualize the value of your membership. In addition, Washington Healthcare on Wednesdays was born. It is a weekly webinar with key DC figures. Here you can network and you can learn about important medical issues going on in the city. Our sections have been very busy and very active participants, especially the Women in Medicine section and the Young Physician section. Next up, we have a new bi-weekly public newsletter and a mobile-friendly website. And with all the health disparities we experience and with the changes going on in Ward 7 and 8, I have taken it personally to advocate for our physicians in Ward 7 and 8 so they can continue to offer their invaluable service to its residents. As you can see, a pandemic does not slow down MSDC. I need to thank the MSDC board for their support and those behind MSDC leadership. To Ms. Rose Smith, who has both dedicated her life to MSDC and has been able to keep us under budget. To Ms. Pia Direa, I don't know how she does it. She knows everyone, and not only that, but she gets things done. And finally, to our EVP, Mr. Robert Hay. We had an exceedingly busy, fun, creative, and extremely productive year. I want to end this meeting how it began, with a little fun. So grab that drink I mentioned at the beginning. I know I need it. Raise it high, and let's have a toast. To the physicians who came before us to prepare us for this day, except that they didn't know that a pandemic was coming. To our colleagues that we don't see often, but now we can do it by Zoom. To our patients who we want nothing but the best. To our office mates and our staff, which I cannot live without them. I don't know you, but I want to toast for them. To our computers and mobile devices that allow us to do telemedicine. And now we treat like they were fine china. To the payers and the insurance that we want to call valuable healthcare partners. To you, the heroes and the shearers of DC every day. And finally, to our medical society, that it may never lose its way. Salud.